The Ebola epidemic in West Africa has now killed 2,500 people, and now American soldiers are being deployed to help. Good evening, I'm Scott Swan.
I'm Anne-Marie Tiernan. It's now 5:30. Thanks for joining us. Now, Indiana Ebola survivor, Dr. Ken Brantley is keeping true on his promise to educate about the risk and pushing to help. In fact, he met with President Obama this morning. Here's a picture of that meeting. And he did this meeting before he testified at a Senate hearing this afternoon. And now the U.S. is, in fact, stepping up its response. New today, the U.S. military will join in the fight against the worst Ebola virus outbreak in history.
Ebola is treatable.
Operation United Assistance will expand the U.S. response in Africa. 3,000 members of the military will deploy. They will not have direct contact with Ebola victims. Their goals will be to build 17 Ebola treatment centers that have 100 hospital beds each. Also set up mobile labs for faster diagnosis and train up to 500 healthcare workers a week.
The best way to contain this epidemic, this outbreak, is by intensifying infection control capabilities.
The U.S. will provide more than 10,000 sets of personal protective equipment and send 400,000 kits to homes in Liberia. They contain gloves, sanitizer, and fever-reducing drugs. About 5,000 people have been infected, half of those cases occurring within just the past month.
The numbers can be kept in the tens of thousands, but that is going to require a much faster escalation of the response.
Nearly 2,500 people have died, and that is likely a vast underestimate. The U.S. plans to send 5,000 more body bags, a grim prediction that the number of dead will grow. President Obama was also briefed today on the Ebola threat at the CDC in Atlanta.